President Dinesh Madhavan has huge plans. He brought this program together, but he has he has rolled out. As we are talking now, if somebody walks into one of our centers tomorrow morning, the test will be available for them. So he has a complete program. The centers that will be able to do it now, the centers that will open more centers, so that our ambition is to detect disease early, especially cancer detected early is a cure. My great compliments for all of you for taking this good news to people, saying, please have a check done. Sometimes people think, oh, is the test expensive? First you must all think that health expenditure is an investment, it is not an expenditure. It is an investment into your good health. So please don't bother about the cost of the test, but I think see the great value that it will add for human life. And human life not only for the individual, for the whole family's happiness. So I think by doing this test, I think we are bringing in another major element in bringing happiness into the family. God bless all of you. We are here, as you all know, in the last 3 decades, we brought whatever is available anywhere in the world. And I assure you, we will continuously do so. Within clinically, we have done whatever possible anywhere. But what we have done in the last 1 year is to be able to bring artificial intelligence, datamatics, robotics, 3D printing and Hyderabad, all these new advances which can make people more healthy and give precision therapy for people. This is the byword for Mozart, that we will always give the precision therapy for all people who are close to us, and the ability to diagnose disease early. God bless you.
Thank you so much, sir. And as a woman, I could say that it is definitely a blessing for all of us, seeing the rapid increase of the breast cancers that we are able to vision these days. It will be just a great blessing for all the women over here to make sure that we can early detect the breast cancer. And as always, Apollo never gets back to amaze us with the technologies from the worldwide to India, and especially in Hyderabad. And yes, now I would request, ladies and gentlemen, I would request the dignitaries on the stage for the photograph for the media. May I request the dignitaries to please stand up for a picture for the media. Thank you so much, sir. May I request you to please take your seats back again. And now, ladies and gentlemen, we will see a short audio visual on Easy Check Breast. May I have the AV on the screen? Can we also have the audio, please? Can we restart the video? with the audio plate.
That 2.3 million women globally are detected with breast cancer every year. 1 in 22 urban women in India are at risk of developing breast cancer. Early detection is the key to winning over breast cancer. Apollo Cancer Centers, along with Datar Cancer Genetics, is glad to be introducing the revolutionary blood test, Easy Check Breast. The test has been granted breakthrough device designation by the US FDA, with an overall accuracy of about 99%, and has been clinically validated by one of the world's largest clinical trials. Now you can detect breast cancer earlier and easier. Book a test now. Visit apollocancercenters.com or simply call 1-800-203-1066.
Well, that was a small EP to be presented about how Easy Check Breast would work. We'll have further addressing. And now, ladies and gentlemen, Mr. Datar is the founder and chairman of Datar Cancer Genetics, a world-leading molecular oncology setup leading in non-invasive testing of various cancer ailments. Now, I would request kindly Mr. Dr. Rajan Datarji to address the gathering. Please put your hands together, everyone.
Good afternoon to everyone. Dr. Pratap Reddy, Mr. Dinesh, Dr. Bhattari, Dr. Sudha, and all my friends in the media and who are joining us virtually. Greetings from Datar Cancer Genetics. I want to start by saying that breast cancer is touching so many women today worldwide, that it is no longer a problem which can be wished away. Many women are being detected with breast cancer much earlier in their life than they were before. The age at which cancer was detected over the years was usually about the age of 45 to 50. Today that age has now come down to around 30 years or so. Presently, mammography is used as a standard of care for detection of breast cancer. In many countries, in India it is used as a recommendation, but not yet widely adopted. This has led to a situation where most women in India who are detected with breast cancer report it at stage 3 or stage 4, where not only is that treatment more expensive, but it is usually toxic and the outcomes are not very encouraging. The best way to cure breast cancer is to detect it early and go for surgical intervention, which Dr. Bhandari will of course throw more light on. The earlier detection is the key for the most optimal treatment. If it has to happen, it must be detected early. And in that sense, although the test may be perceived as being a cancer detection test, it is a good news test because we give the bad news early enough to be rectified. The test has been validated in more than 40,000 individuals as part of a large clinical trial, and the accuracy has been outstanding at about 99%, with virtually no false positives, which means that we don't detect or we don't say that somebody has cancer when actually nobody has cancer. This is a very important part because mammography today has poor specificity, which means that many women are detected with a suspicious finding on the mammography, leading to more tests and more investigations, which oftentimes are found to be benign. And this causes a lot of anxiety to the patient and expense, of course. This blood test has virtually eliminated any false positives with a very high sensitivity. This can, of course, be done from the convenience of the person's house or office or wherever blood can be taken. So the convenience of this test as opposed to mammography can be very well realized. The test works on the detection of circulating tumor cells which are released by tumors and are very rare in the normal blood cells which are usually found in the blood and are extremely difficult to detect. I am very proud to say that we have developed this test in India with the effort of Indian scientists and equipment and intelligence, where we are the world's best test available today. And again, I am very proud to say that the test is available across 20 countries in Europe, in the United States, as well as in India. We are privileged to be associated with Apollo Hospitals and the Apollo Group, that this test is now being made available to women in India at a very affordable cost, and it will be our pleasure to expand this portfolio to other tests as well for other cancers where we want to upstage, we want to bring the stage of the detection of the disease as early as possible, from the present stage 3 to 4 to stage 1 and 2 as far as possible. Incidentally, I may mention that the United Kingdom has made it a policy decision that the detection of cancers in that country should be brought down at stage 1 and 2 to 70% of all cancers detected by 2030. We are attempting to do a similar thing in India, and we encourage more and more women to take this test, at least to begin with, so that the breast cancer incidence can be curtailed by early detection and cure. We wish to expand this, as I mentioned, to other cancers, colon cancer, lung cancer, prostate cancer, and so on, as we move forward. And it will be our endeavor to make this test available to the Indian population at very reasonable rates, so that most people in the country can have the cancer detected early and have interventions at the earliest possible time. To conclude, I can say that as an Indian company, it is a matter of immense pride that we are the world's best test for detection of breast cancer today anywhere in the world, and we will continue to strive to put India on the map of the world for this cutting-edge technology. I thank Dr. Reddy for his continued blessings and guidance, and the Apollo Group for their support, and I look forward to be of more help and more assistance to the Indian population. Thank you very much.
Thank you so much, sir, for your kind words. And indeed, yes, talking about the rapid increase in breast test and how it can be really useful for all the women in India. And now, ladies and gentlemen, Dr. Sudha Yasmurthy, an oncopathologist with 22 years of experience in premier cancer institutes and an astute healthcare management professional speaker, will take us through the brief presentation of Easy Check Breast. May I request Ms. Dr. Sudhaji to please take over.
Good morning, dignitaries on the dais, off the dais, ladies and gentlemen. May I have the PowerPoint presentation, please? It's my honor and privilege to present a few excerpts from the Easy Check trial and the study, so as to make you understand this in simple language. So moving on, I would not bother you with the statistics. We know breast cancers are growing at an alarming rate, and these are the highest, the incidence of breast cancers is the highest among all cancers in females, and it's our responsibility as a healthcare conscious, health professionals to curb this disease, which is called deadly, and we do not want to call it deadly anymore. Let us accept it. Let us try to curb that fear from the woman and come forward to get her test or the screening test done. So just to allude to some of the data here, if you can look at the Western statistics to the left, you can see that the deaths are not as many as compared to the incidence of breast cancer. Whereas India, if you see, it's nearly 50%. These are Globocan statistics and not our data. And to the right, again, if you could see, in India, we pick up cancers in the later stages, generally the stage 3 and stage 4, as opposed to the Western world where screening solutions are robust. There are screening programs and they are picking up early, so they can conquer cancer earlier. And it is our responsibility now to increase this segment, which is trying to pick up cancers, as our Reverend Chairman Sir has spoken, in the early stages itself. And also, if you could look at the graph below, the mortality is much lesser. You can conquer when it is at an early stage, what we call the stage 0 or the duct carcinoma in situ. That is before it has invaded. So either at stage 0 or stage 1. These are the situations where we need to capture and pick up patients to conquer this disease. Yeah, so just to give a perspective, this is the